Bismillahir Rahmanir Rahim. My name is Professor Amal, Professor of Forensic and Toxicology and Clinical Toxicology, and our lecture today will be on the medical records and medical certificates given by a physician to the patients in any circumstances. By the end of this lecture, you will be able to be aware of the importance of medical records, which are the files in the hospital, to identify the circumstances in which a physician is asked to issue a medical record or a certificate, and also to recognize the legal rules on issuing a medical record or a certificate. We are going to start by the medical records in clinics or hospital. These are a group of papers present in a certain folder, and this folder contains all what was done to the patient, starting from entering the hospital until the discharge of the hospital. The medical records are considered ethical, scientific, and administrative and legal documents. They are documents which have great importance for many organizations and also for the patient. They should be having all the data related to the patient in a sequence of the events to justify any diagnosis given to the patient, the treatment that was given, and by the end, the outcome of the case. The medical records are of great importance. For the patient, they can get from the physician a certificate of the discharge record denoting that he was admitted to the hospital at a certain date, he was suffering from a certain disease, and the type of treatment is written for him, and also the time he will need to rest after being discharged from the hospital. For the physician and nurses, we consider the physician and the nurses the caregiver. What is meant by caregiver? The personnel who are taking care of the patient or are making putting the treatment of the patient in action. There is a professional responsibility of the physician and in addition to the nurses and pharmacists. It is considered evidence-based practice, and also continuity of the medical care is ensured by this. The doctor is writing the treatment and the nurses are fulfilling them and giving them to the patient. It is a method of communication between the group of the healthcare giver in this case. They are admissible in the court in case of when there is any case that will be referred to the court, when there is a negligence or malpractice, the patient himself or his family will sue the doctor or sue the hospital for a case, and these documents will be the evidence base of what has been done to the patients. For the hospital, it is controlling the quality of care. Now we are in an era in which every process or any intervention to the patient is considered controlled by certain quality. These are evidence-based, and we provide evidence that the care was necessary for the patient. This is called the quality control. Also, it describes the response of the care, whether the patient responded or not responded to the treatment given, so that we can change the guidelines in a certain disease. It describes any changes in the plan of treatment. This is a quality control, again, denoting evidence-based that there is a change in the condition of the patient, and therefore there is a change in the plan of treatment of this patient. The coordination of the clinical care of a patient is between different groups. The group contains, starting from the physician, then the pharmacists who prepare the drugs, and the nurses who are giving the drugs to the patient, in addition to the hospital authority from the administrative point of view. The plan of intervention is very important to be done. The decision making about any ongoing intervention is present in this document, and also evaluating the patient progress is important for the hospital and it is used by any team member present in the group which are giving care to that patient. For the health authority, any statistics done by the health authority will include the data which are derived from the hospital. Different hospitals are giving their data to the health authority in the country, and by which we can determine the morbidity and mortality of the different diseases present in the country. Also the vital events which are present, is there an epidemic, is there a disease ongoing, is appearance of any disease up to the case, and the health statistics are produced to be determined in any conference which will be international one, on the national and the international basis. The most important documents that should be included in the folder or in the file of the patient are, first of all, the admission sheet, in which the name of the patient, the date of admission, and the provisional diagnosis present. Then the progressive notes are added every day, and then if the patient is needing an intervention like surgery, we have to get an informed consent for any intervention by the patient. Informed consent, we mean that the patient should agree and should understand what is going to be done for him. If the patient is refusing treatment, this refusal should be documented in this file. If an operation is done, the surgical notes are documents of what happened to that patient and the type of the surgery done and what happened in the operation room. Any incident occurring to the patient during his admission to the hospital should be reported in these files. And by the end, we are writing the discharge summary, which will be giving a conclusion of what happened to the case, that a certain patient, male or female, and his age, was admitted to the hospital with a certain disease and received treatment so and so, and by the end he is discharged. And we mean by the discharge, is he cured, is there complications of this case, are there any diminution of his work later on. All these should be present in the discharge summary, which is documented by the physician and also by the hospital administration too. These documents, as I said, which are legal and ethical, should be effective. And to get these documents to be effective, there are certain elements that should be fulfilled. What are these elements? The data itself should be, or the records should be signed and dated by the physician. Every part written in the document should be, a date should be written, and also the signature of the doctor and the stamp of the doctor put on that part. The spelling should be correct. Otherwise, the medication name, especially the medication names, otherwise a complication may occur when a patient is given not a correct one, but incorrect medication. We have to use the common vocabulary and the common terminology used by the physician. The abbreviations and the symbols should not be applied except when they are of international value and agreed upon by all the caregivers together. The contents should be sequential. We mean when a patient, when the doctor is seeing the patient in the morning, he will write down that he saw the patient or observed the patient at 9 o'clock in the morning. When he is observing him in the evening, he should write that in the evening later and in a sequence of the paper later on, not in the before the previous one. All data should be accurate and complete. And also there is another recommendation for the physician, that they should not leave any loose end after writing in the papers of the patient. The papers should be fulfilled and written in a certain legal form and written in a very correct and accurate way. Do not blame or criticize others. Any discussion about the treatment given should be between the physician, then agreement upon and rewritten again. This is considered, all of these are legal and ethical principles. When you find any error written in your documents, we do not use any whitener. The corrector is not used on legal documents. And never scratch out what is present in this document. We put a line in a transverse way so that it can be left what is written under it available and read, being able to be read by any person. Otherwise, anyone who will read this with the whitener or a scratch on it will be suspicious that something wrong happened to the patient. This is an example to a sheet where we cannot read the diagnosis, we cannot read any treatment given, and we cannot read what was the recommendations given by the doctor. Even the name of the doctor himself is not even being able to be read in this sheet. The liability of the physician and the hospital is related to the fulfillment of these documents. The patient's attorney usually will be observing whether there is an illegal note or whether our illegible note, or whether the physician was too busy to write or clarify what is present to the patient. Usually he will be suspicious what are the physicians hiding. Remember, what's not written is not done by the physician. So you should write everything done to the patient by the physician, by the nurses. Both should write in the documents and sign and giving the date of each paper. Something to think about: if you get cases and you are called in the court when the case is sued and the doctor or the hospital is sued, the paper should be complete from the start. There is no time to complete what is present. Usually what is going to be done to the physician, he will be confined if there is and getting he will be punished for this by erasing his name from the practicing this the medicine. Storage and keeping medical records. The medical records should be stored in the hospital in a way where they are arranged either alphabetically or in departments or in date. By date we can look for a certain file present at a certain date, and these should be available. Within a very short time I can reach the medical records of a certain patient. The way of storage should be very in order and correct and accurate, so that we can track and retrieve the papers in a very short time. We get the data in the timely manner, and also when the patient is moved from one department in the hospital to another department, the files should be moving with him. The files, when he is admitted to the internal medicine department and later he will be surgered upon, or an operation will be done for him, we have to, he will move from the department of internal medicine to the surgery by the same files and the same medical records which present from the start of admission to the hospital. Keeping the medical records is very important because there is obligation to keep these records so that when they are needed from any legal authority, they should be present. The follow-up of the patient condition is through this, and also the legal requirement in criminal cases should be obliged, and any investigation of medical malpractice needs these documents. Very recently we used the computer-based record. The computer-based method is putting the data of the patient on a computer system. It should be standardized. It is illegal, again, but the court is usually needing papers. Till now, our court in Egypt is needing the documents on paper, even if you are going to giving a CD or a flash memory containing the data of the patient. the computer-based record is very helpful for the hospital itself. It helps to assess, to get access to the records, to retrieve the data, to update the data, and also the communication between the healthcare giver is present and is evident by this. But there is a point which should be confirmed, the confidentiality of the patient. All the data which are present in the medical record are confidential. No other person should be reading this data. Therefore, the computer program should not be accessed except by the authorized person giving the care for the patient. We end this part by a very good recommendation that good documentation will increase the medical protection, the legal protection of the healthcare provider, whether nurses or physicians. And we are going to shift to the second part of our lecture today, the medical records and certificates. All of the physicians are meeting some conditions or some circumstances in which they are obliged to give either a report or certificate, either to the patient or to legal authorities needing these papers. What are these? They are very great number of documents. We are writing them throughout our practice. First of all, a birth certificate. A birth certificate is signed by the doctor, denoting that a certain child or newly born, male or female, at a certain date and in a certain hospital by the name of his parent given in them, and the parent will take them to the health authorities to get the official birth certificate. But this is written first by a physician. Vaccination is given by physician, especially the vaccination of children, or in cases of there is a disease of communicable and we have to get vaccination all over the country. The type of the vaccine and time of the vaccination should be written accurately and signed by the physician or the nurse giving them or administering them to the patient. Communicable disease, when there is a communicable disease, the doctors should recognize it and write down a paper or a report or a certificate to the health authority in the country denoting that there is a communicable disease found in a certain area of our country. Death. We have certain conditions in the hospital that a patient may die. By the end of the treatment, for any reason, the patient died. So we have to issue a death certificate. The death certificate should be written in the local language of the country. In Egypt, it's written in Arabic. In France, it's written in French, and so on. The death certificate includes the name of the deceased, the sex, the age, the date of death. These are related to the data related to the deceased himself, and data related to the disease itself, mainly the proximate cause of death and the original illness from which the patient suffered. Certain categories of death need medico-legal autopsy. Sometimes we cannot issue this death certificate when there is a medico-legal issue present in this. In this case, we ask for a forensic expert from the Department of Law, and they do what is called the medico-legal autopsy and do the dissection of the dead body and find out the cause of death. What are these conditions? When there is suspicion of foul play, we mean by foul play that there is a case of homicide or suicide. Homicide, a person did something bad to the patient, so he killed him. In cases of murder, medico-legal autopsy should be done. In cases of death due to accident, also a medico-legal autopsy is done, because the end of this accident, when the patient is a victim of an accident, especially car accident or road traffic accident, his family will need compensation from the person who was the convicting this one or doing this accident. In cases of suicide, all cases are considered medico-legal importance, and medico-legal autopsy should be done. to ensure that this was a case of suicide. Suicide means a person is killing himself. Any case of violence or signs of violence present on the patient should be fulfilling medico-legal autopsy, and the medico-legal expert or forensic expert is going to find what is present in this case and what was the cause of death. Any negligence in the treatment, also in this case, we don't write the death certificate, but the medico-legal expert is going to do. Industrial death, when a person who is working in a certain factory and death occurred to him, these cases should be autopsied or dissection should be done to know what was the cause of death. In cases of industrial death, the factory itself may be able or should give some money or compensation to the family of the person. When the patient dies during an operation, sometimes the disease itself and the physician present, the surgeon present at the operation are convinced that there is no foul play present, or otherwise on the operation table it may be lead to a case of malpractice condition. When the case is a malpractice, autopsy should be done, and the forensic expert is going to write down had the physician done any misconduct or not. Other types of certificates is the certificate for an injury. Report of the injury is given by the physicians which are present in the administration of the hospital or the triage area of the hospital. They are examining cases of emergency, and when there is an injury, they will write a primary report of an injury. The primary report will include two parts. Part related to the name, age, and sex of the patient and where he is resident, and the other part will be related to the injury itself. It will determine the type of injury, the site of the injury, the instrument which was used in conflicting this injury, any other associated lesions related to it, any treatment given to the patient, and the expected time for cure. Because the legal aspect of the injury is whether the person will be out of his work or out of his college or his school for a period of time. The time to be cured should be present in the legal record of or primary record of injury. Another report or another certificate in cases of work accident. When a person is working in a factory and there is an accident occurring, there should be a certificate denoting that what was the cause of the accident, because there is some responsibility of the person himself or the worker or the factory itself. When the case or the cause of the injury is related to the factory, he may need compensation or money given from the factory to the patient. The effect should be written down. The effects we mean by it, if the patient is going to suffer from any infirmity later on or not. Infirmity means he will suffer from something that will be diminished his way of work. So the time of the cure is very important, and the complications of the injury are very important. Another type in the factory too, a person may be poisoned by the fumes which are present in this place or in this factory. When the patient is related or is affected by this also needs compensation by the factory to give to the patient. He should be given lesser work if the poison is affecting his general health, or he should change the place of work later on. This will be considered a responsibility of the work itself or a responsibility of the factory in which he is working. Age estimation is important in some areas, especially in the village, small villages. There is delayed in determining the age of any person. Sometimes when a crime is occurring, every country has put an age of criminal responsibility under which the person will be lesser responsible. When a person is convicting a crime, he will be convicted in front of the court. When his age in Egypt is below 18, he will be convicted in front of juvenile court. Therefore, his age is very important. Sometimes his family will say he is below the age and there is no certificate. In this condition, the physician is going to determine his age. In cases of rape, the female is examined for her age because again, the punishment of the person who committed this crime of rape will be more when the female is below 18 years. In cases of marriage, in some countries, they are giving females marriage given at age below the legal age of marriage, which is 18 in Egypt, and difference from one country to another. So the father will bring his daughter to be examined to determine her age by the physician. Test of sanity. What is meaning of sanity? Sanity means is the person sane or insane? Is his mentality all right or he is not all right? There are two important conditions in which we give a certificate for a patient for sanity. Either the patient is incapable of doing a crime and he is asked to do some test to determine is he sane or not, in which case we say he was eligible to do this crime or understanding that he is committing a crime or not. Another condition, one member of the family is accusing a patient, his relative that he is insane, so that he will take the care of his estate. So he will ask for examination by a forensic psychiatrist, and this one will say if the patient or if the person sane or not, and give a certificate for that. Sick leave. Sick leave is a very common certificate given by doctors to a person. Maybe he is ill or he is not ill. He will give to his work, to his school, to his university, saying that he is sick and was not able to attend a lecture or to attend the school or to attend his work. These cases sometimes are right or sometimes there is a foul play in writing them. Therefore, there are some legal rules which should be fulfilled when we are giving the patient or the persons any certificate. They should be given to the patient or to the authority who asked for this certificate. They should be accurately written, not in a hurry, and the spelling should be right. They should not include any personal expectation by the physician. They should explain what the physician is seeing in the patient, not denoting anything else. They should not be dictated. They should include all the details of the cases. They should include the identity of the patient giving to him the certificate, and also the identity of the doctor. We mean by it the signature of the doctor. The criminal law is saying that anyone giving a fake certificate denoting that a certain person has got a certain disease will be convicted in front of the court for forgery. Again, if the physician who is writing the medical certificate, which is not true or misleading, will be accused. And when this accused of forgery, and forgery that means that he is giving a certificate which is not true and written in a false way, he will be punished either by being in jail or in imprisonment. He will be in prison, or he will pay a fine before he is coming out, or the name of this physician is erased from the medical registry and he will not be able to practice medicine later on. These all are very important for a certificate to be given and a certificate to be legal, and these all are recommendations from you even before you start your clinical periods. you should be aware of any medical registration or any medical certificate or any medical report you are giving to a patient. Be sure and fulfill all the legal rules which we are present. Thank you very much, and you are going to get a tutorial about this topic later on by one of my colleagues. Thank you.